Hi everyone, welcome back. I've been doing quite a few medical related posts lately, so I thought I would do a slightly more sports related post, and I'm going to talk about soft tissue dysfunction versus soft tissue injury, and sort of what the difference is. I should say both of those can be helped with massage. So let's start with dysfunctional tissue. What is dysfunctional tissue? Well, it's basically non-pathological, so there's no, there's no disease, there's no injury, there's no inflammation. It's generally just demonstrated by aches and pains in the body. Basically, while the body generally will adapt to any, demands placed on it, if there is repeated stress, it can cause an imbalance in the tissues, which obviously then puts you at risk of injury. So, it could be something really simple like, first time mum, and she's suddenly, supporting weight of baby. Quite often, we carry baby on one side, and, so that can be sort of repeated stress on that side of the body. But yeah, so possible causes of tissue dysfunction. It could be your body composition, sort of balance of or percentage of muscle tissue and how strong and flexible those muscles are. Inactive lifestyles, if you're a bit of a couch potato, again, you're going to be more prone to aches and pains because you're going to reduce, the flexibility in your tissues is going to be reduced. And so you're just going to notice aches and pains more. Any lifestyle imbalances really, or repetitive occupational movements or occupational stress. So a classic example would be someone who has a desk job in an office. Those repetitive movements with the mouse and the keyboard are just well known for, causing issues around the neck and the shoulders. Any physically demanding hobbies, could cause tissue dysfunction, or sleeping position. People sometimes, quite often, if they're sleeping on their side, they sleep a bit awkwardly, and that can cause issues around, the shoulder and the neck. Poor posture, which again, that goes back to particularly if you have an inactive lifestyle, or if you don't do a lot of exercise, you may have develop a weakness, particularly in the hamstrings, which, your hamstrings have a protective mechanism by which when you're sitting, they help to, pull on the pelvis and just support that alignment of the spine when you're sitting. So if you've got weak hamstrings, you're more likely to have that slumped sitting position and rounded bottom of the back. Poor exercise technique, again, you might put a bit more stress on joints when, you don't need to if you do the, exercises correctly. And again, certainly for gym goers, but not always, something called synergistic dominance, which is basically where certain muscles will overcompensate for a weak muscle. Classic example, say in runners, if they've got weak glutes, they may find that they suddenly get sort of a lot of aches in their calves, just where sort of the body posture and alignment when they're running is altered. So it's going to place more, you're going to get more impact through certain certain joints. And also adhesions, whether it's through having had surgery or, even if you've had some sort of inflammation at some point, your tissues can stick together. That can cause, some pain. So they are the common causes of tissue dysfunction. But so how does tissue injury vary? Well, so whereas the dysfunction is non-pathological, injury actually happens when the soft tissue is subjected to a force that is basically just too much and it can't absorb the impact. So it may be due to a direct impact or trauma, something where the tissues basically exceed the normal range of movement. And there's various types of soft tissue injury. So first you've got primary and secondary injuries. So with the primary injuries, these are the ones that are due to an initial trauma. So they can be intrinsic, which means that they're caused by forces within the body, such as weak muscles, or some sort of underlying imbalance in the muscles. Some people just, for example, with their chest muscles, one side may just develop more than the other side. So that will cause a weakness. Or it could be overuse of the muscle. If you've been really, really training incredibly hard and really pushing yourself at the gym, maybe lifting weights that are a little bit too heavy, you're going to get a lot of overuse. Or it could be something like a strained hamstring, during a 100-meter sprint, because that's sudden kind of burst of power required by those soft tissues. So that's intrinsic, primary injury, or you've got extrinsic, which is due to is caused by forces outside the body. So that could be something like taking a hit when, in a boxing match, something that, you can't really control. So then we have our secondary injuries, and these happen as a consequence of those primary injuries that we've just talked about. So quite often they will be due to some sort of compensatory posture. So for example, if you have knee pain, quite often that can be a result of some sort of previous calf injury, maybe a muscle strain. Then we have what's called non-consequential injuries. So these are not sport related, but they will interfere with your sporting ability. It could be something like, if you tripped in the road or something, sprained your ankle, that would then interfere with your ability to do sport. We have a mechanism of injury, which is basically any action that results in a stress pattern, which will then damage specific tissues in the body. Skin injuries, strains, which is a tear in the muscle or tendon due to an excessive overload. And that's going to happen when you have had a previous injury, a previous primary injury. strains can then be a consequence of that. And sprains also, so injuries of the ligaments due to overstretching, which again, if you've got previous injury or inflammation, it's going to be more prone to these secondary injuries. Tendinopathies, which is basically the rupture of a tendon, which will then cause inflammation. It can also cover degeneration of a tendon, which can happen without inflammation. And also capsular ligaments or joint capsule damage, which will be caused by trauma, will cause accumulation of fibrous tissue and adhesions around that joint capsule. And the shoulder is known for this. And potentially then you're going to get loss of movement where all that sort of scar tissue forms around the joint. So that's the difference between tissue dysfunction and tissue injury. All of these things can be treated by massage, and I will be going on to do videos about specific injuries and specific muscle groups, and exactly how massage can help and what to look out for, and how you can treat these injuries. But certainly this is where kind of things like maintenance sports massage comes in, because you can treat any tissue dysfunction hopefully before any injury occurs, so you can try and fix sort of any weakness or imbalance in the muscle before you've got that injury, which can then lead on to future injuries. And cause scar tissue and all these other things that can cause pain and inflammation. So keep your eye out for those videos. They will be coming up. And but I think I'm going to leave it there for today. So that was a pretty brief and basic video today. But just to give a little bit of a background for those future topics that I'm going to be covering. So any questions, please feel free to contact me as always through my Facebook or Instagram. But for now, that is all from me. So I will see you next time. Bye.